Have you had COVID-19? I want to hear from you. 217-629-7970 at 8:11. It is the WMAY morning news feed. I'm Greg Bishop. And again, you can call in live and local, 217-629-7970. You can also email bishoponair@gmail.com or find me on Facebook, Instagram, Twitter, YouTube. Just search out Bishop on Air and we can connect that way. So health officials across the globe are saying they expect to see a precipitous decline in the number of COVID-19 cases because it seems like it's spread so fast, this most recent wave, and practically everybody's expected to get it at some time. We've got Mayor Jim Langfelder, who's got COVID-19. He's isolating at home, says the symptoms are mild, like a runny nose or a cold. You've got even Chicago Mayor Lori Lightfoot, both of which vaccine and boosted, getting COVID-19 and saying that it's just mild symptoms. And you've also got, the European Union, various countries over there looking at treating COVID like the flu. And even up in Chicago, you had the Chicago Department of Public Health Commissioner, Dr. Allison Arwady, last week say that those who are boosted and vaccinated seem to have, flu-like symptoms, and it really is behaving like the flu. So I want to hear from you. Have you had COVID-19 lately? And is this something that you're still struggling with, or are you over it? Did you get over it? 217-629-7970 is the phone number. Again, 217-629-7970. That's the phone number here for the WMAY morning news feed. I did have a friend recently. He shared with us that he was tested positive for COVID, and just did a daily health check with him. And he said that today's his last day of isolation after having isolated for the past 5+ days. And the peak of it, he said, really it came in waves. It seemed to be fever and body aches. He would sleep roughly, and some of the sleep wasn't that great, and that was for a couple of days, and then the body aches kind of went away and really just felt like a cold, he said. But now he's fine. I don't know, and I got to talk with him more. Maybe we can get together and get some drinks and some lunch or something. But I want to know what kind of therapeutics did he talk to a primary care doctor? Did they say, you know what, go get some Tamiflu, drink lots of fluids, sleep when you can, take lots of hot shower? What are you being told about how to deal with COVID-19? I want to hear from you, 217-629-7970. This as we've got all the numbers that are being reported, and I want to go through some of the numbers, at least from the Department of Public Health. And if you're watching online at our Facebook page, just search out Bishop on Air, you can see here that some of the numbers, of course, for cases, absolutely skyrocketing. I mean, the 7-day average is 29,000 cases. So that's just massive. You can see that the most recent wave, just an incredible number of cases. That's just Illinois. But if you look at the deaths that are coming from those cases, we have yet to get to the point where we saw deaths back in 2020 of December. So we're seeing that, but also I think something else you have to look at is hospital bed capacity. And I've zoomed in here on the IDPH graph, and you can kind of see that we're seeing a little bit of a plateau of sorts of the number of hospital beds that are taken up with COVID-19 patients. But also, and I'll zoom out here to look at the entire picture of COVID-19 hospital beds, and you can see the total number of staffed beds continues to decline. And I think that's one reason why we see just the continued stories about the hospital capacity issues. Why are we seeing decreasing number of hospital staff beds? A variety of things at play there. 217-629-7970. But as we expect everybody to get COVID, and they expect the case numbers to decline precipitously because apparently it's spread everywhere so fast, even with mitigations in place. How are you dealing with it? Have you had it? What have your doctors told you? Good morning. You're on WMAY.
Well, good morning, Greg. I wore the mask for the first 2 weeks about 3 years ago. Haven't had any shots.
about 2 years ago.
Well,
It
whatever
feels
it
like a
was,
decade. It feels like we were born into this. But anyways, go ahead.
I gave him the first 2 weeks exactly. None of my family, we don't have any of that shots or anything. Don't wear the masks, and none of us have even gotten the flu or cold enough. It's dealing with it like that. I'm letting
All
my
right. Well, so you haven't had it then. Okay, I appreciate that. That's not the call prompt. I don't know how you did in English class. Whenever they would give you a prompt and you'd have to do a little essay. But the prompt now is: have you had COVID? How did you deal with it? What did your doctors have to say? Good morning. Let's get to this call here: 217-629-7970. Good morning.
Good morning, Greg. Yeah, I do believe I have it or had it, and I did not get tested for it. It was early in all of this, mid-January of 2020, and I
Oh,
haven't
so
had the flu
it was even before there was a major
Yes,
pandemic.
yes. My brother-in-law had gotten something coming back from Chicago. I had been doing work at his house. A couple days later, I started getting the body ache and chills.
Well, and I had friends as well who, before it was declared a pandemic, said they came down with something that was just, they were out for like a week, just not feeling great at all. Just fevers, chills, and so on. But that was 2 years ago, if not more. Here we are now, a new variant, Omicron, Deltacron, Delta, Sigma, Pi, Alpha, whatever. So the new variants seem to be less severe. And I'm curious if you've had to deal with this in your household, you as an individual. What have your doctors had to say? Good morning. You're on WMAY.
Hey, Greg. So I got to participate in one of the variants about a week after Christmas. My mom, I guess she came down with it from some lady at church who was found to have had it, but who knows where it comes from. I'm 41 years old. I'm definitely not vaccinated. Don't ever plan on getting vaccinated. When I found out that I had COVID, I said, well, I guess I can't go to the gym. So it was a big middle finger to the diagnosis. I went on a 5-mile run, in which I completed in about 36 minutes.
Whoa.
The only thing that I noticed was I had heaviness on my chest, and it kind of felt maybe there was some pressure with my heart and my lungs. And it seemed like it got worse during the run.
Sure.
But I mean, the next day after I ran, I felt amazing. It still took a while for all the symptoms to go away, but I feel fine.
Appreciate the call, 217-629-7970. Not everybody has the same types of outcomes. I mean, there are people, and even the CDC highlighted how if you're vaccinated and boosted, if you've got comorbidities, you're not going to have a good time. You're already unwell, and if you get COVID, you're not going to have a good time. And it could lead to severe illness or death. And they said that 75% of those who died from COVID who were vaccinated and boosted had at least 4 comorbidities. So you really got to think about that when you're thinking about your own health. Are you eating garbage? Are you drinking garbage? Are you not taking care of yourself? Are you not getting that regular exercise? Are you not getting enough sleep? Are you just all around an unhealthy person? Likely the vaccines and the boosters, yeah, they might help a little bit, but you should really be focusing on other things to get you healthy as well. But I'm curious if you've had COVID, how did you deal with it? And what did your doctor have to say? Did they offer up any suggestions for therapies? Good morning. You're on WMAY.
Yeah, I'm a nurse and I've had COVID. Supposedly I've had it twice. I've tested positive twice. First outcome, like I said, I never lost sense of smell or anything, but I did lose 20 pounds, and that was August of 2020.
Wow.
There was no therapies recommended then.
Well, as a nurse now, I'm sure it's still very much in your purview as to how this is being dealt with. How is it being dealt with, other than ventilators?
Well, here's what I tell you: we need early treatment, and I can explain the science why. I've learned this through everything I've been reading and this personal experience, but testing is the best thing a person can do. Testing is you get tested early, you got to treat it early before the virus builds a army.
Right.
You need a zinc iodophore, and you also need zinc on board. The zinc iodophore is like the gun, and then the zinc is the bullet. And without the combination, it doesn't work. And so the virus has to attach to a cell membrane of a human cell or a regular cell in order to reproduce. You want to stop that reproduction.
And that's what the zinc is meant to do, right? Is meant to kind of keep that that fusing from happening.
Right. If you think about it like cancer, you want to kill the cancer when it's isolated or cut it out before it spreads, and it's the same kind of theory.
Yeah.
And my doctor, who I switched all my doctors since all this because I lost a lot of confidence in doctors.
Wow.
My doctor prescribed zinc over the counter, Cusarin works, and then the gun will either be ivermectin, hydroxychloroquine, or Cusarin.
Sir, how dare you? How dare you, sir? How dare you utter those words?
Well, that's what works.
It's amazing. I mean, in being in the field, have you ever seen anything to the point where if something is shown to work, like we've seen some doctors, they may not be Dr. Fauci, but some doctors have said hydroxychloroquine, ivermectin, early treatments, low doses of those in combination with, like you're saying, the zinc and other things, those are working. Have you ever seen in your time in the medical field that people push against that? Against the possibility of something working to help make people more healthy? I mean, isn't the Hippocratic Oath to do no harm?
Right. Not at this level. I mean, you've always seen, you've heard of off-label uses for things.
It's like 30% of the time drugs get prescribed for off-label uses.
Right. And so I've never seen it like this to where governors are actually stopping everything. But if you go and you find the examples in the literature, when the hydroxychloroquine first came out, you will see that, the studies they were using, people were vented for 17 days plus. It will not work then. The army of the virus is built, and it absolutely will not work. The other thing is they were doing 2,400 milligram doses of hydroxychloroquine, which I'd say hydroxychloroquine is not the drug of choice. I'd say it's ivermectin based on the MolDoc scores and the protease inhibitor time that works. But no, I've never seen anything like this. And what I'm seeing, people come in now, they've lost a lot of confidence. Instead of saying, how can you help me? They've lost total confidence and they're coming into the hospital wanting and demanding a certain regimen. But my metaphor for this is that you walk into a hospital now ill and they tell you to leave and come back if you get hit by a freight train. And
it's got to be frustrating as somebody in the field. I appreciate it. Thanks for being there, and thanks for sharing your thoughts too. And again, I'm not a doctor. I'm not giving any kind of medical advice. We're just raising various questions about how some treatments have just been totally blacklisted by the establishment. Why? I'm not really certain, but maybe it's something that we can delve deeper into. It is the WMAY Morning News.